Good morning, everyone. I am Sophia Arcelia and I will be discussing the first part of our group's report. So for number 1, the walls of the ureter consists of 3 layers, which are the fibrous coat or the tunica adventitia, the muscular coat or the tunica muscularis, and the mucous coat or the tunica mucosa. Number 2, the intramural portion of the ureter is lined by the transitional epithelium or stratified urothelium. The circular muscle layer of the intramural portion disappears, and the ureter runs an oblique course through the bladder wall. Number 3, the layers of the urinary bladder are the mucosa, submucosa, muscular layer, serosa, and adventitia. The lining epithelium of the bladder wall is designed to have cells that increase in size and number in order to accommodate the stretching of the bladder wall, and the layers include the apical layer, the intermediate layer, and the basal layer. Number 4, the serosal layer of the bladder is a thin connective tissue layer covering the bladder dome and is continuous with the peritoneal layer of the abdominal wall. Number 5, the renal calyx, ureter, and muscular wall of the bladder are all lined by transitional epithelium. However, the bladder has a thicker transitional epithelium and wider lamina propria than the ureter.
Good morning, everyone. I'm Micaela Jordan D. Sampiano and I will be reporting the second part of our group activity, the segments of the male urethra. First is the prostatic urethra, which is about 3 to 4 centimeters long, that begins at the neck of the bladder. It passes through the prostate from the base to the apex, where it becomes continuous with the membranous part of the urethra. This part of the urethra is the widest and most dilatable portion. The membranous urethra is about 1.25 centimeters long and lies within the urogenital diaphragm, surrounded by the sphincter urethrae muscle. It is the least dilatable portion of the urethra, and the urothelium changes into stratified columnar to pseudostratified columnar epithelium. Thick layer of skeletal muscle is present at the level of the external urethral sphincter. The penile urethra is about 6 inches long and is enclosed in the bulb and the corpus spongiosum of the penis. The external meatus is the narrowest part of the entire urethra. The part of the urethra that lies within the glans penis is dilated to form the fossa terminalis, or the navicular fossa. The bulbourethral glands open in the penile urethra below the urogenital diaphragm. It is lined by stratified columnar and pseudostratified columnar epithelium, except for the terminal portion. So how do we differentiate the segments of the male urethra as to lining epithelium and sublayers? For the pre-prostatic urethra, it is lined with the transitional lining epithelium, and its sublayers is embedded within the walls of the urinary bladder. For the prostatic urethra, it is lined by the transitional lining epithelium, surrounded by glandular and stromal tissues, and the sublayer is the widest part of the male urethra, containing the urethral crest, seminal colliculus, prostatic utricle, and the orifices of the prostatic duct. The membranous urethra is lined by the pseudostratified columnar epithelium, and its sublayer passes through the deep perineal pouch, the external urethral sphincter, the perineal membrane, and the bulbourethral gland lies just posterior to this portion. The penile spongy urethra is lined by the pseudostratified columnar epithelium for the proximal portion, and stratified squamous epithelium for the distal portion. Its sublayer enters the bulb of the penis and widens again in the glands of the penis, forming the navicular fossa. The bulbourethral and urethral glands empty into this portion. Fossa navicularis is a wider caliber than the proximal urethra. Its vertical elliptical shape resembles a laterally compressed flip-like passage. The fossa navicularis is covered by a thin layer of fibrous tissue called the septum glandis. The mucosa keeps the urothelium moist and the urethra supple. The proximal segment of the mucosa is lined by urothelium, and after a few millimeters, the urothelium gives way to a stratified non-keratinized squamous epithelium containing abundant deposits of glycogen. The distal segment changes shortly to stratified non-keratinized squamous epithelium, which continues into the epithelium of the labia minora. The tunica muscularis consists of smooth and striated muscle filled up the sphincter of the urinary bladder. the lacunae of Morgany are also called the urethral lacunae of the male urethra. These are small depressions or recesses on the surface of the mucous membrane of the spongy urethra into which the ducts of the urethral glands empty. Their openings are usually directed distally, and the largest of these recesses is called lacuna magna or sinus of the ring. The Littrus gland or Morgany's gland is a structure composed of mucus-secreting cuboidal epithelial cells that are organized into branching ducts and terminal alveoli. In human embryos, these glands are usually located in the anterior 2/3 of the pelvic wall.